Local leaders are coming together trying to solve the childcare crisis. They say it's a deepening problem driven by extremely low wages, and it's causing a historic labor shortage.
Brian Wilk was at a roundtable discussion and has our report tonight. He joins us in the newsroom. Brian.
Officials tell us that the staffing shortage is closing classrooms and creating a burden for working families. State lawmakers and community leaders gathered for a roundtable discussion with a focus on the child care crisis and how to solve it. There were also reports that detail the scope and impact of the crisis both statewide and locally. According to Ready Nation, gaps in the state's child care system are costing families, taxpayers, and employers about $6.65 billion annually in lost earnings, productivity, and tax revenue. Low wages are creating a historic labor shortage.
That is impacting not only child care teachers, but when there's no child care teachers, it impacts working families that need child care, that go off to work at hotels, amusement parks, our factories. Child care is the workforce behind the workforce.
He says there are actions the private sector can take, and there are policy changes that can emerge from these conversations.
That's why we're thrilled to be joined by state lawmakers here. June is, of course, budget month in Harrisburg, and we are looking for state lawmakers to invest in the child care workforce by increasing the wages for child care teachers across the Commonwealth.
Michelle Harkins with Early Connections says there are over 1,700 children in Erie County on a wait list. They need more child care staff.
They're paid at such a low wage, it's hard to find someone that would want to work at the center. So we're trying to come up with solutions to be able to bring the wages of our child care workers up. They deserve it. They are taking care of children's lives every day and need to be supported.
According to Ready Nation, 56% of state parents that were surveyed say that they were actually late for work due to their child care struggles.